Hi, everyone. Thanks for joining us. We're going to be going over the 6 things you need to know to pass your practical exam. Now, if you've joined me in a webinar before, you'll know that my name is Caitlin Proctor. I am the founder of PT Exam Prep. I'm a Canadian trained physiotherapist. So I finished my schooling at the University of British Columbia. I currently work in private practice in orthopedics, as well as I create all the content for PT Exam Prep students and students like you who are joining us today for these free webinars. So what we're going to go through today is, again, those 6 things I feel like you need to know. Now, we do this for the written and we do it again for the practical because there are really key things that you need to know. We're not going to be going in depth of any topics, but I'm going to be giving you a good overview and some strong study strategies for you to use when you're preparing for your exam. So my first point that I want to go over with you guys is make a study plan. Okay. So this is a really important tip. And the reason why I feel this is important is because preparing is the best way to have success in this exam. So the first thing is find partners. Now, there's a lot of you guys here. There's over 100 of you here today listening to this webinar. So there's lots of people out there that are interested, that are, active in trying to prepare for this exam. I do find it hard sometimes with some of the Canadian universities. They're not really as open to allowing international students to come prepare with them. But if you are an international student, or heck, if you're a Canadian student that's here today, international students are amazing to study with. They have a lot of great information, and one of the best ways to practice is to teach. So if you're a Canadian student, take one of those international students into your group and help them. I strongly suggest looking for groups of 2 to 3. Okay, if you're practicing face-to-face, try to practice with as many people as possible. All right, join discussion groups, post in this discussion, let them know that you're wanting to practice, let them know that you're taking the PT Exam Prep course if you are, because I know there's a lot of students out there who are really, whether they can't afford to take a course, they want to get as much information off you as possible. So, use that to your advantage when you're looking for people. If you are somewhere that is a little bit more remote, so looking at some of these, these places on here, I'm seeing there's a Halifax. There's actually quite a few people studying in Halifax for this November exam. I know one of my lovely people is in Kelowna, and actually, you know what? I'm going to pair the two of you guys up because I know both of you. So yeah, I will contact you guys afterwards. But if you're in one of those cities, do post that you are looking for a partner. If you are, again, in one of those more remote locations, I really suggest only meeting online. So whether that be over the phone, over FaceTime, over Skype, just meet with one person. So online, 2 people is the best. But what we really are looking for when you guys are meeting is we want you to have the format of student meaning, the physio. The other one would be actor, and the other one would be marker. Okay, so this is really important because we want you guys to have this breakdown because the marker is the most important role. Okay, while you are the marker, you can reflect on what you would do differently. You can give your criticisms, and you know that if you miss something as a marker, you for sure would have missed that as being the physio. Okay, so make sure that you're trying as much as you can to give really, really focused feedback. So if you go into the handouts, you're going to see the marking checklist there. The marking checklist, as you can see on the screen too, it's hard to see because it is so small, but everyone has been sent that in the handouts. You're going to see that there are these 5 main areas that we want you to evaluate when you are that marker. So opening a station, there's a proper way to open a station, okay? There's a 7-step way to make sure you're getting all of those marks. Safety and precautions, of course, are super important. Interaction, technique, organization. These are the 5 main categories that we think are important, and you need to assess in every single station that you're working with someone. Now, we didn't make these 5 categories up. This actually comes from the marking guide on the Alliance, and you can see all this in their blueprint as well. But we've just kind of picked pieces out of it and made it a little bit easier for you guys to comprehend, and of course, made the checklist for you. So super, super important. The next thing I want to say about finding a study partner is you want to set very firm times of when you're meeting. Okay. So for example, if you guys are meeting, every Monday from 8 to 10 p.m., you need to make that a priority that that's when you're going to meet. Okay. So let's talk about the continue studying theory portion of this. This is my next point in the make a study plan. So I always get told that the hardest stations on the exam are the 5 by 5 minute stations. Now I know a lot of you guys are taking this exam for your first time. So hopefully by now you know the difference that you have 10-minute stations, you have 8 of them, and you have 8 5 by 5 minute stations, meaning you have a 5-minute clinical interaction and a 5-minute follow-up where you're doing a written station, okay? Um, Remember, you will be asked something relevant to the interaction that you just did, okay? Make sure that you are succinct and writing very clearly in the box when they give you these 5 by 5 minute stations, because the markers actually mark your answers while the next student is doing their written portion. So they're always marking. And they're only getting, if you count in, some movement, they're getting about 4 minutes to mark what you've written down. And they're marking a ton of these. So be short in your answers, be clear and succinct, do not write more than you should, and always stay within the box, okay? So again, these questions are really linked to the interaction that you just did. So the studying theory portion of this is important. I suggest that when you start studying, so when you're in, your beginning third of studying, and I'm going to use vague timelines like that because I know some of you are studying 3 months before, some of you are studying 6 months before, but you want to be studying at the start about 50% practical and 50% theory. Right? As you get closer to the exam, you're around 2 months or so away, you want to be doing about 60% practical, 40% theory. As you get right up into the exam, and we're looking here at about 6 weeks up to the exam, you really want to be spending the majority of your time practicing. So 70% of your time practicing and 30% of your time doing the actual theory material. Okay, and for example, something that is theory material would be memorizing all your contraindications. Of course, this is going to be used in your station if it so comes up, but that's the type of information we want you to be focusing on. Okay, last, make a study schedule. Okay, this doesn't have to be super detailed, but you should know what to expect at the start of each week. By this time, many physios are working, coupled with, they're studying, coupled with family obligations. It gets harder to study for the practical because, you have your marks back. A lot of you guys have interim licenses and you are working. So if you know what your week looks like, you can plan and prepare better. So how we suggest is, if you know your group likes to meet Tuesdays, Thursdays, Saturdays, you make sure this is a priority. You make sure that you're there. You make sure that you prepare whatever you need to do before. If you're taking a course and the course is say, every Monday night or every Saturday, you might want to schedule a bit of time the few days before so you can prepare all the information that your teacher has asked you to do. And then you can kind of fit in or piece in that self-study piece because that's a little bit easier. You don't have to plan as much. Okay, but the practical exam's hard. You really do need to make it a priority to meet with other students, and they have their own schedules that they're balancing. So I really, really suggest this, okay? Actually, no, I don't suggest. I say it's absolutely mandatory. If you're taking that November exam, you need a schedule, okay? And this is so that you and your partner or partners are meeting constantly, okay? If you're like me, it's really important to even plan things in like sleep and exercise. I know this probably sounds crazy to some of you, but even just planning in a 30-minute walk or a 30-minute session of a Netflix episode can make all the difference in your sanity. So please make sure you're making time in your schedule for yourself as well. Okay. So my point number 2 is nail your introduction, and I mean nail it. The introduction is super important because this is the first impression that that marker is going to get of you. Now, there's tons of research out there done on how important first impressions are. And in an exam situation like this, where they are seeing a ton and a ton of people go through and do the exact same station all day long, it's really important that you put yourself forward with the best foot, and really are clear, concise, and speak great, proper, clear English as you are doing this. I know a lot of you are joining us from different countries, English may not be your first language, but this really needs to be something that you are so succinct in saying. Okay, so the 7 steps here that we want to go over. Number 1, you want to say hi, what your name and what your title is. Okay, you also want to ask the patient what their preferred name is. If the station vignette did say something like, this is Bill, you would walk in and say, hi Bill, is this is your preferred name? Or hi Bill, is this a name you'd like me to go by today? You also need to state the purpose of your interaction. So whether you say, it will involve me showing you some exercises, or I will be getting you up and moving you to the other side of the room and back. You need to ask your PPD. So do you have any pain, dizziness, or discomfort? Super important. You're going to check back in with this information multiple times in the station as well. Okay. You also are going to ask if they have any questions. Now, the whole purpose of your introduction, again, is to give them a good impression of you, but it's ultimately to get consent. Now, there are very specific components to informed consent. And one of the main components is you need to give them a time, or you need to give them a chance to ask any questions. So again, just as important as saying, do I have consent, is do you have any questions? Next, you say, do I have your consent to proceed? And we often suggest in the course saying this word for word, do I have your consent to proceed? Pretty easy. And last is breaks. So breaks, this is a tough one. On top of breaks, we want you to say, I'm going to clear the area of any obstacles. All right. Now remember, when you're putting brakes on, if it is a shoulder station, this is important, guys. If it is a shoulder station, so meaning you are doing stability testing, or any muscle testing or anything around the shoulder, you want to say, do you have any shoulder issues? If they do, support the shoulder, hold onto the front of the bed. Otherwise, when you're putting the brakes on, get them to just grasp behind them, extend both arms, and hold onto the bed. Okay. This should take you no more than 45 seconds. Use a timer and time yourself when you practice, okay? So here we go. We have an example here, and it's a patient who's a 22-year-old soccer player who just sprained their ankle at their soccer game, okay, on the weekend. Take a focused history with regards to their lateral ankle pain. So I'm going to do this introduction for you, and then we're actually going to get a few of you guys to help me out here, okay? So here we go. Hello, my name is Caitlin Proctor, and I will be your interim physiotherapist working with you today. I understand that you sprained your ankle on the weekend, and what I would like to do today is to ask you a few questions about your ankle pain. It'll involve me asking you about how it happened, if you have any issues at all now pertaining to that injury. So if you have any pain, dizziness, or discomfort at any time, please let me know and we can find a more comfortable position to put you in. Do you have any questions? No. Do I have your consent to proceed? Yes. Now, I'm just going to go and check the brakes, and I'm going to clear the area of any clutter. Perfect. Now, before we begin, I'm just going to make sure that you're seated in a comfortable position. Great. So that's what it should look like, really, really fast. It took me around 30 seconds, okay? So we have some scenarios here. What I am going to do is I am able to see all the attendees here, and we can actually see everyone we can see you if you put your hand up or put your hand down. So I'm going to put everyone's hand down. If you would like to try scenario 1, I will unmute you. Everyone can hear you. No one will know who you are, don't worry. But I'd love to see if anyone's willing to try scenario 1 for me. So let's see if anyone puts their hands up. My goodness, no one's putting their hand up. Come on. Okay, perfect. Okay, we got someone. Here we go. I'm going to put you on here. We're going to unmute you. Perfect. Can you hear me, Smriti?
Yes.
Okay,
Hello?
hi. Hi, awesome. Okay, so everyone can hear you. We're going to do scenario 1. So your patient is 87 years old and requires you to teach her diaphragmatic breathing. All right. I'm going to go back to the 7 steps so you can go through them, but whenever you're ready. Are you ready to go?
Yep.
Okay, go for it.
Um, Hi, my name is Smriti Singh. I'm a physiotherapy resident here. May I know your preferred name, please?
It's Caitlin.
Hi, Caitlin. How are you today?
Good.
So today I'm going to. I understand that you have a problem with your breathing. So today what I'm going to do is I'm going to teach you some breathing exercises so that it'll help you it'll help to improve your breathing. Is that okay with you?
Yes.
Do you have any pain or any discomfort right now?
Nope.
Do you have any questions for me before I start?
No.
Do I have your consent to proceed?
Yes.
Okay, so I'm just going to check the brakes. Okay, that looks fine.
Awesome.
So,
That was perfect. That was so, so good. I'm very, very impressed at how good you did that. Okay, great. So I'm going to unmute you now, or sorry, mute you now. Okay, we're going to do one more here. Okay, so this time I'm not going to put up those 7 steps. So again, I'm going to put everyone's hand down. If you're willing to go over scenario 2, please throw your hand up and I will randomly pick someone again. Awesome. Okay. We're gonna do Sagrika. I'm sorry. I know a lot of you guys here, so I'm gonna get you to do it for us. You're unmuted. Can you hear us there?
yeah.
Awesome. Okay, so we're gonna do scenario 2 whenever you're ready.
Okay. Yeah.
Perfect, and you can go.
Hi, my name is Sagrika and I'm going to be your interim physiotherapist. May I know your preferred name?
It's Caitlin.
Hi, Caitlin. Caitlin, from your charts, I came to know that you are experiencing some problem, and I'm here to teach you some ergonomic and to educate you about some ergonomic care. Does that sound good to you?
Mm-hmm.
So, do you have any questions regarding that?
Nope.
So, do you have any pain or discomfort right now?
Nope.
So, do I have the consent to proceed?
Yes.
Thank you. Before I start, I would like to check the brakes of the bike. So they look fine. So we are good to proceed now.
Okay. Thank you.
Yeah.
All right, I'm gonna mute you, Sagrika. So good job, guys. I mean, I put you on the spot. You got a lot of people listening to you, so awesome. But a few things I just want to point out for both of them. Um, for your purpose of interaction, you want to keep this short and succinct. You guys did a good job, but you could say what I'm going to do is an ergonomic assessment may not be the most layman term. So what I'm going to do is I'm going to get you sitting at your desk. I'm going to take a look at what your posture is in sitting, what your posture is when you're working, and give you some information, feedback around that. Both of you guys didn't say the dizziness parts. Remember, PDD super important. Pain, dizziness, or discomfort. You can kind of tailor it for each station. So, for the ergonomic assessment, it may not be something that you really need to ask. But when we're looking at something like diaphragmatic breathing, you want to say, do you have any pain, dizziness, or discomfort right now? No. Okay. If you do have any pain, dizziness, or discomfort at any point in time, please let me know and we can stop and start whenever you feel comfortable. Okay. So tailor that piece a little bit. Perfect. Okay. That was great. I'm super, super happy that you guys were able to do such a good job with that one. Now, number 3, this is my next point, okay? This is a super, super important one, and this is I fast forwarded. So it's know how to mobilize a patient, okay? I sometimes struggle putting this one into the webinar because It's such a huge, huge category. There's so much to know around this that it's really hard. It doesn't really do it justice to put it into a webinar, but nonetheless, I hope some information is better than none. But first of all, it's really going to change how you're doing the station, whether it is their first time up or if they have been up before. Now, we recently sent out a video to quite a few, or to anyone who was on our emailing list, explaining that we have a new video out, and it's the 3 things you have to do no matter who you are mobilizing. So just by a show of hands, you're going to put everyone's hands down. Who was able to watch that video? Okay, good. It looks like a lot of you guys were, which is great. But you know, I'd still say maybe it's only about half of you. So at the end of today, I will send out the link, or sorry, at the when you guys, I think it's about an hour after the session, you'll get an email. You can fill it out, and then we'll give you a free pediatric station to try. And you're also going to get the recording of today's session, and you'll also get access to that video as well. So just look for that email. It'll come up about an hour after the session today. Okay. So super, super good video to watch, but let's go back to what we're doing right now. And that is this your first time up? Again, you have a different plan if the answer is yes or if it's no. If this is their first time mobilizing, remember, there are a few things you absolutely need to do. You need to ask about what their pre-injury ambulation and use of aid was. You need to perform a DBT check. You of course need to expose the area and palpate, look for hot swollen calf tenderness. You need to do the Homan sign, and you need to do muscle testing. Again, I'm going through this pretty quick, but the video does such a good job at explaining that just look out for that video and take a look, okay? Now, there are 2 different types of muscle testing. There is a lower extremity muscle testing and the upper extremity muscle testing. If the patient says to you, you know, before I didn't use any mobility aids, and you know the question is making you believe that they're probably not going to need a mobility aid as well, then you don't necessarily have to do upper extremity strength. We're doing upper extremity strength if the person is using a walker, if the person is using crutches. If this is the first time mobilizing this patient, you want to use some sort of a mobility aid, okay? Unless there's someone who is like a 14-year-old, you know, but even, I'm actually gonna retract that. I would always use some sort of mobility aid if it's their first time. So the 2 lower extremity strength testing you're gonna do is hip flexion and knee extension. Hip flexion can be done through just marching on the spot, and knee extension just simply get them to extend their bottom half of the leg. Now, if you were doing upper extremity, we suggest to check tricep strength, but they can just simply unweight themselves by pushing up. Again, this is all in the video. And they can also check grip strength, so just getting them to squeeze your hand, okay? Of course, you're gonna check in with any pain, dizziness, or discomfort, again, PDV, and that's pretty much the main thing that you wanna do if this is the first time that that patient has been up. Okay, now a question that we get asked quite often, and something that's really important to note, that on your exam, if someone ever does say yes to feeling dizzy, what you want to do is you want to try to get them to stay in the position that they're in, and just get them to, you know, hold onto the bed, make sure you have a hand on them, hand on the transfer belt, and just see if the dizziness goes away in about 10 seconds. Then again, check in, okay? If they say, you know what, I'm not dizzy anymore, perfect, keep going. And some actors are actually cued to say, yes, I feel dizzy when you ask them. Okay, so make sure they're just, you know, sitting, you know, don't, if they're standing, just get them back into sitting. If they're lying, keep them in lying. If the patient says, again, when you're asking, you know what, I'm still really dizzy, then get them back down into a lying position. Okay, now if this is really early on in your station, you may want to just check in again in, you know, 30 seconds. But generally, we have found that the best thing to do is if a patient reports being dizzy, check in again in around 10 seconds or so. Okay. And again, you really need to ask about that mobility aid, okay? We're gonna talk about that a bit more, but the next step is setting up the room. So when you set up the room, this means that you're doing this before you're getting that patient up, okay? And how you're gonna do that is you're gonna see, you know, if the station is saying that you want to mobilize someone to the door and back, it's really important, 100% important, that you set up a chair halfway. So if it's to the door and back, then you set it up at the door. Okay, so put that chair at the door. It's a place for your patient to sit if they're getting tired or dizzy. Okay. And I'm going to see if any of you guys kind of can catch on to this, but in what scenario should we avoid sitting in a normal chair? So what type of mobilization station would we say a chair maybe might not be the best thing? Yeah, well, the good thing is that the people who have responded to this question are all in the course. So good job, guys. I'm going to see if anyone who's not in the course is going to respond. No, looks like we just got our all stars there. Okay. Well, yes, you guys are right. In the event of a total hip replacement, we would not set up a chair, or I lie. We would set up a chair, but we would put a pillow or something there. And the reason for that is we don't want them to sit and break 90 degrees. It's also hard for them to get that much hip flexion right away. So make sure that you are putting that pillow or foam or something on the chair, okay? So of course, you want to clear the area. This should have been done in your intro, but something that's important to do. You want to put the transfer belt close to the patient before you start. If there's no transfer belt, of course, you would, when we get to that setting of the patient, you would state that you're putting one on them. You always put their runners on if they have them. And another question we get a ton is, what about if there's no shoes? If there's no shoes, you want to go barefoot, okay? Even if they're wearing flip-flops, you want to go barefoot. If they do have the slippers or socks with the little grips on the bottom, those are perfect to use as well, okay? But if they have normal socks or flip-flops, you're putting them in barefoot. Next is setting up the patient. So setting up the patient means there's a few things you need to think about. If it's a stroke patient, you want to protect the shoulder. You want to use a sling if it's necessary. If there's no sling in the room, you would tuck it into their sweater or hold it with the other arm, or even you as a therapist can provide support. If it's a total hip replacement, of course, you're going to make sure you go through those precautions before, no crossing midline, internal rotation, or flexion past 90. But you really want to use layman's terms for these. So, for example, I do not want you to bend down to grab your shoes. I do not want you to cross your legs. You're going to set up any lines or tubes that are in the area. We'll talk about this a little bit more. Make sure they're not tangled. Make sure you're not breaking any contraindications with these as well. If it's a TBI or ABI, you want to make sure that you're using slow, good, succinct, instructions. If there are any sternal precautions, you want to make sure that you're educating them on that, whether they can push or pull. And of course, you want to, just make sure that you're paying attention to pain too. So really important to set up the patient, all right? Next is setting up the transfer aid. So if it's a wheelchair, you want to lift up the armrest closer to the patient. You want to remove those foot pedals. You want to angle the wheelchair close to the bed. And of course, brakes have to be on. Brakes are just as important being on in that wheelchair as they are on the bed when you start your station. Now, this is a question that we often get, if you are setting a patient up and you realize that you cannot figure out the dang wheelchair, what you do in that situation is you just state, I would remove the armrest or I would remove this foot plate, but I can't figure out how to use this wheelchair. In that event, the marker may come and choose to help you, or they may say proceed. Okay, so you're going to have to work with many different personalities through markers. So just know that if you verbalize everything, you're going to do much better than if you just kind of think things in your head. So if you don't know how to use one of the pieces of equipment, please say so. Okay, if you're going to do a sliding board, of course, you need to teach them to place it under the glute. You can offload contralaterally for placement. Warn them about pitching the fingers underneath. If it's a spinal cord injury hand, you want to make sure they put it in a fist to protect tenodesis. If it's a walker, you want to teach them how to properly sit to stand. Advise them not to pull up. You want to use the bed. So lots of different things that you can do to kind of set up that transfer aid. Okay, and last is setting up the gait aid. So with the gait aid, you want to make sure that you're checking to make sure that you're looking at the bottom of it. You're trying to see it sturdy. You're looking at the sorry, I can't think of what I'm saying by the bottom of it. You're looking at the, oh my goodness, having a brain fart here, but you want to make sure that all the pads on the bottom are not worn out. Okay, same as when you're looking at the handles. You can take a look at the screws, just feel it, and just verbally state, "I'm checking the gait aid to ensure that it's safe." Okay. There's tons of different gait aids out there that you need to know how to use and which one is appropriate to prescribe to which person. Again, way too much to go into right now. But one thing I do want to, bring your attention to is if there's a station where, say, someone has post-sternal precautions, you need to be careful with walkers. Sometimes they like to give you tricky questions like they have a femur fracture, as well as, say, something like a Colles fracture. They may be on the same side, opposite side. You need to know what you would do in those situations. Okay, so that's my point number 3. Point number 3 is a huge point, as I said, guys. So really make sure that you're spending a lot of time learning and how to properly mobilize a patient, okay? Okay, so next point we're going to go into is know your contraindications. So I'm going to get you guys to help me out a little bit with this one. So active range of motion and passive range of motion. Can anyone tell me a few contraindications for this? So what would you say in a station if it asked you to do active range of motion or passive range of motion? What would you do before you start doing that? Okay, yeah, so asking about if they have an unhealed fracture. Perfect. Anything else, guys? Perfect, perfect. Yeah, ask if they have any infections, ask if there's any history of subluxation or dislocation, myositis ossificans, acute inflammation. So the important thing that I want to bring your guys' attention to, good, a lot of you guys, you got some good ones here, but the big thing that I want to bring your attention to is you want to just ask a few of these. You want to have a few good contraindications that you're going to clear for all these kind of major tests. All right. You may have the marker who stops you after a few and says, great, that's awesome. You may have a marker that makes you keep going. And if the marker makes you keep going, say either what you know, or go until you've said around 7 or 8. That's usually what I say. Okay. The other really important point to this question is that even though you've said it in the station, it may be in the 5 by 5 minute follow-up. So be prepared to write some sort of contraindication list in your follow-up questions. Okay. So again, this is something that we can send out later, but and I'll send you the links so that you can get all these emailed to you. But the big ones that I want to bring your attention to here for sure for active range of motion are things like if they do have an infection, a fracture, subluxation, or dislocation. Okay. The next thing that I want to ask you about is neurodynamic testing. So with neurodynamic testing, there are some definite reasons why we would not do neurodynamic testing. Who knows what neurodynamic testing is? Anyone? Anyone? Great, yeah, so that could be like our upper limb tension tests. What else? Slump tests, great. Good. Anyone else? Slump? Good. Perfect. Yes. Straight leg raise. Awesome. Good job, guys. Okay. So what are some reasons why we would stop or things that we would clear before doing our neurological testing? Yeah, I'm not seeing too many people say the correct answer for this. Okay, so the big ones that I want you guys to have here are things like hard neurological signs, okay? If their condition is worsening as you're testing, if they have a spinal cord problem or a spinal cord or cauda equina compromise, or if they have severe irritability. Okay, so again, not as kind of what some of you guys are saying here. So, we really want to make sure that you're specific. So the 5-minute station could say, what are some reasons why you would stop neurodynamic testing? If there were hard neurological signs, if they had worsening condition as you're testing, if they had spinal cord or cauda equina compromise, or if they had severe irritability. Okay, a lot of you guys are saying the 5 Ds. So that's a tricky one. The 5 Ds, truthfully, you're going to have to test that in your cervical scan. If you are positive for any of those, of course, you're not going to go on to your neurodynamic testing. So the 5 Ds would not be a correct answer because in theory, you should have already tested those, but before doing neurodynamic testing. So a little bit of a tricky question, but the question should have stated, you've completed your cervical scan and are now on to neurodynamic testing. Okay. Okay, someone said, what about autonomic dysreflexia? So yeah, perfect. If they are getting signs of autonomic dysreflexia, you would definitely want to stop. Does anyone know what you would do if you had signs of autonomic dysreflexia as you were doing neurodynamic testing? Oh, so we have a lot of people responding right now. I'd say it's about 50-50. So some people are saying keep the patient upright, and some of them are saying lie the patient down. Pretty interesting. Okay, so definitely a lot of you guys are saying, check for the noxious stimulus. So for sure, check for that noxious stimulus, whether or not, just doing the neurodynamic testing could potentially be the noxious stimulus that you're doing. But, the debate seems to be here, keep them upright or lie them down. So what is happening in autonomic dysreflexia? Anyone kind of answer that? So I'm going a little off track here, but I think it's important to know that, autonomic dysreflexia is a syndrome when there's a sudden onset of this excessively high blood pressure, okay? It's more common in people with spinal cord injuries, or that's really who we see it in, that involve the thoracic nerves or spine above that T6 area, okay? So we want to think of, whether we're going to sit them up or lie them down. So when we have blood pressure that's getting really, really high, we need to think about what we're going to do. So maybe I can ask you this question to see if this kind of helps you think about it. But if you had a patient who was fainting, so blood pressure is really low, what would you do? Good, this seems like it's getting some of you guys thinking. Yeah, you would lie them down if they had really low blood pressure. So if you had a patient who had really high blood pressure, what would you do? The opposite. You would sit them up. Right? So there's quite a few of you that, as I said, we're saying to lie them down with autonomic dysreflexia. So make sure that you know the difference. Again, that would be a safety fail. So think about low blood pressure, someone's fainted, lie them down. High blood pressure, something like autonomic dysreflexia, sit them up. Okay, awesome. Sorry we got a little off track there, but we'll keep going. So the next contraindication I want you guys to know is for percussions and vibrations. So I'm going to teach you guys something here, and it's something called burp for me. It's a little bit of a random saying, but it's the acronym BURRP for FOH, me. Okay, so I actually don't have this on my screen, but again, it's BURRP FOH, me. Now, this is a great way to remember your contraindications when you're doing perks and vibrations. And again, this will come in the follow-up email too that you'll get in a few days. So B meaning burns, U, unstable head injury, a cardiovascular condition, R, recent skin graft, R, resectable tumor, P, pneumothorax, F, fracture, O, osteoporosis, H, hemorrhage, M, metastatic bone cancer, and E, emphysema. Okay, so, really important here to know these. So again, burp for me, and I will send this to you guys so you'll have all this information, but it's a really great acronym. And again, you want to ask these before you do anything in your percussions and vibration station. Okay, next we're going to go on to know your contraindications for a chest tube, catheter, IV, pole. Okay, so we are going to look at the chest tube first. So when you're using a chest tube with a patient, what is the contraindication here that we're looking for? Again, get you guys to type that in for me. So what do we not want to do with a chest tube, or what are we going to make sure that we're doing with a chest tube? Okay, so a lot of you guys are saying don't disrupt it. Okay, yes, that works, but what specifically are we doing? Again, some of you guys are saying kink it or dislodge it. Yeah, okay, these are important, but what is the main thing that we're looking? Some of you guys are saying not higher than the heart. Okay. The big thing that we're looking for here is we want to keep it under the insertion point. So wherever it is inserted into, we want to keep it under. And the reason for that is we want to make sure there's no back drainage. Okay. So sometimes the chest tube can actually be quite low. I don't know if any of you guys have worked with patients with chest tubes, but it really just depends on where they've gone in. There's kind of one main area that, 99% of the time it should be. But again, remember on the exam, it could be in different places because, of course, they don't actually have a real chest tube in. So you want to make sure that you keep it below the level of insertion, or below below the level of insertion, I would just say. So again, if this comes in your 5 by 5 minute station, please put in below the level of insertion. Catheter, hopefully you guys will know, same thing, below the level of insertion. And what about IV pull? What is this going to give you information for? Anyone going to take a stab at the IV pull? So not getting a lot of people saying what they would do for the IV. So the IV is a bit of a tricky one. We want to keep the pole on the same side as the arm, or the same side as the IV site. Good job. Good job. A few of you guys are getting this. Awesome. So again, we would always want to make sure that, when you go into your station, part of getting the patient ready, if you are doing a transfer, is to make sure that you're getting the lines ready. So, put the chest tube on the same side, make sure as you're moving it, you're keeping it below the level of insertion, and be obvious, be obnoxiously obvious that you're keeping it below the insertion site, and say that. Same with the catheter and the IV. It doesn't matter if you have to lift it over the patient, but make sure it's clear through their gown, and make sure it's clear that it's not on the other side. Okay. So someone had just asked if I can repeat the contraindications for the neurodynamic testing. What will happen at the end of this webinar today is that you're going to have the option to put in your information, and what will happen is over the next kind of few days, weeks, you're going to be getting all this information kind of trickled into your inbox, and we've broken it up really nicely for you. So we will send that to you. Okay, the next thing that I want to go over here is point number 5, exercise prescription. So exercise prescription is super, super important. You're pretty much guaranteed to get an exercise prescription station on your exam. So the big thing here is that you want to make sure that you're finding the appropriate exercise for this person. So what I want you to think about here is stages of healing. So if you have a patient that is post-op, say 2 days, you're going to be giving them a different exercise versus if someone is, say, 8 weeks post-op. If you give that 8 weeks post-op person, a bed mobility exercise, you may get, 1 out of 10 marks, but you're not going to get your full 10 out of 10 marks by giving them a proper exercise. So really, really make sure that you're paying attention to what stage of healing they're in. Next, and this is super important, you have to demonstrate the exercise. Okay, you have to demonstrate the exercise. The patient then has to perform the exercise. And you need to give them feedback on performance. And we're going to talk about this feedback in the next slide. And then you're going to prescribe using your FIT principles. Now, again, I'm being very vague with this because these are just kind of the 5 main steps to exercise prescription. If you guys are in a course, you should have gone through these at nausea. It's one of the first things that we go through. If you're even in the practical crash course of ours, we will have gone through this a lot as well to make sure that you guys fully understand exercise prescription, because you're going to need this for the exam. But the next kind of point I want to talk about is this performance piece. Now, say your patient is asked to do, let's say, a squat. And in doing the squat, you think, dang, that's a good squat. I don't really think I would give too much feedback. I want you to make up feedback then. Give them something, okay? They need to have feedback from you. I guarantee you that no one will be doing this perfect on the exam because they want you to get the points for giving them advice or giving them feedback on performance. So let's take a look at this picture right here. Let's say that we've given this runner a good runner stretch or an iliopsoas stretch. What type of feedback would you give this person? What's wrong with this picture? Just waiting for anyone to answer. Good, okay, getting some of you guys saying some good stuff here. So Awesome. So the big thing is that we're saying that you want to keep the knees behind the toes good. You want to go into an anterior pelvic tilt. That anterior pelvic tilt, if she's in too much anterior pelvic tilt, you want to get her into that posterior pelvic tilt. Yep, good job, guys. Good. Back, like look at that lumbar lordosis there. Hey, way too much. So really paying attention to that. So even if we just take a look at this, there's lots that you can correct. Okay, you can even see that her heel at the front is coming off the ground. But my big things would, just find something on that patient to make sure that you're getting your full marks when you are giving feedback for exercise. Okay, last point here, give it all you got. All right, so point one of this is avoid slang, okay? Don't listen to me. I have tons of slang. Oh my goodness. I talk really fast too. So all things that would mean that I would do terrible on my exam if I had to do it at this point. But the knowledge part I would get. But you want to avoid slang. You want to be professional and you want to be likable. Now this kind of sounds funny, but you need to know that on the exam there are marks for do they want you to join the profession? Simply put, do they want you in the profession with them? If you come across as cocky or arrogant or, don't give off that warm vibe, then they just may not give you those marks. So really, really important, guys, be likable, okay? Be professional and avoid slang. So I'm going to kind of point out one culture that we get a lot of people preparing for is people who have come from India. Now, in every country, of course, there's different ways to say things. And one of the ways that we say to someone is, do you have any questions? One of the ways that we find a lot of people from India will say is, do you have any doubts? Now, that's just not something that is commonly said here. It actually makes you feel a little bit uncomfortable. Do I have any doubts? Should I have any doubts? I really don't think I have any doubts, but maybe I do now that you just asked me if I had doubts. So avoid slang like that. Really try to make sure that your questions are appropriate to the culture. So say instead of do you have any doubts, do you have any questions? Okay. Next is don't study the night before the exam. So really, really important here, guys. You want to just give yourself a bit of a brain break. Super important that night before the exam. You've put in your effort. You've done everything you can do and just relax. Remember, this exam is different from the written. It's not, you go, you're in your own silo and you just, bust out the exam. This is really, you need a personality. You need to be thinking on your feet and you need to be clear in your brain. So find something you like to do, whether that is, go play tennis, whether it's doing some pottery, whether it's reading a book, but just clear your head, okay? You will not do yourself any favors by studying that night before the exam. The night before my exam, I went out rock climbing. It was wonderful. In hindsight, maybe don't do that because if you hurt yourself, then you won't be able to be prepared for that exam the next day. But really just do something that you enjoy doing and clear your brain. Again, you want to be likable. You want to be a human. You don't want to be a sleep-deprived zombie, okay? Next, take the exam only once. So there's a reason why I got so happy when so many of you guys said that this is your first attempt, and that's because there really only should be one attempt at this exam. This exam does test, your safety and your fundamentals of the theory. Without proper guidance, sometimes people just study the wrong things. Sometimes anxiety is a huge, huge portion of why people don't pass the exam. They're brilliant practitioners, they're brilliant clinicians, but just the way that they present themselves on the exam is kind of this shy, unsure person, and not confident at all. So those are really tough things, and you want to make sure that you're working on that now. Okay, you guys do have time before your exam. Go talk to a counselor or a psychologist if you're finding exam anxieties are really tough. Talk to me. I would love to chat with you guys. I talk to people all the time about exam anxiety, and we can talk about some strategies around that too. Probably could do a whole other webinar on that. But really important, guys, take this exam once, prepare properly the first time. Don't waste an attempt, okay? So the other thing that I want you guys to do, as I said, about an hour after this webinar, you guys are going to get an email. It's going to prompt you to fill out a bit of a form that is going to put you guys into the a sequence of just getting a bunch of different emails from us. And one of them is this pediatric station. So don't worry, you guys will get this later. And it actually will come with the answer key as well. So a lot of good information. As this is a recording, if there are some of you guys who are watching this, go to our website. On our homepage, you'll see there is the free OSCE station. Just submit your email to that and we will send this over to you. Okay, so my bonus tip number 7, and I know a lot of you guys here are in the course already. So if you want to stick around, awesome. If you guys have questions, I'm going to take your questions here in a few minutes, but we're just going to go through because I know throughout this webinar, I've had a lot of people just asking some questions about the course, and I've just totally ignored you. So now I hope I'm able to answer you. But who should take a course? So a course is definitely for someone who is on their second or third attempt. And this list here, if you say yes to any of them, that should kind of give you an idea that you might need a little bit more help preparing for this exam. So if you're on your second or third attempt, if you're an internationally trained physio, if you're someone who needs to start working right away, this is really important. So if you're someone who, you're providing for a family, if you've been out of work for a while, if you're transitioning from another country here and you need that physio paycheck, and physios get paid very good, you really want to think about taking some sort of course, okay? So if you've been out of school for a long time, so we say a long time is about 3 years or more. All right. If you scored less than 450 on the written exam, now the written exam, we know that the passing range changes and we know that the score in general changes. But if you're scoring over 450, we know you did a good job. So we're not too concerned about that theory material. You're obviously understanding how the Alliance tests. If you do score under 450, then again, you might want to think about getting some help. And remember, the practical exam has a higher fail rate than the written. Okay. So next thing that we're going to chat about here is what is involved in this practical course. So our practical course, there's 10 sessions. We have either in person or virtual. There's a max 6 students to 1 teacher ratio. If you are registered in the virtual courses, you'll notice it's a much lower ratio. It's only 2 students to 1 teacher. We do have this large course manual. We have ethics workbooks. We have a lot of information for you guys to go through. We have videos for you to watch, station templates. And of course, all of our teachers are Canadian trained physios. One of the questions that I got here is, after you completed the exam, can you apply to work as a PT exam prep teacher? Now, a lot of Canadian students do take our course. So in that case, of course, we have a very thorough hiring procedure. But if you are an internationally trained physio, I do apologize. We only hire Canadian trained physios to teach. And that's purely because we want to make sure that we're giving you all the tips and tricks, as much as we can, teach our teachers in our intense program that we give them to teach. Ultimately, we want them to be a Canadian trained physio. All right, so a little bit of a heads up here. We do have one course that still has spots in it. Every other course is sold out. So Ottawa is gone. Our existing Toronto courses are all gone. Surrey, Vancouver is gone, and virtual is gone. But we just opened this course a few days ago, and it's in the Lawrence Park area of Toronto. So I suggest any of you guys who are within kind of that 2-hour driving distance. I know 2 hours sounds crazy, but we have people that come from all over for these live courses. But this course starts October 9th. It's every Tuesday and Thursday from 10 a.m. to 1 p.m. Super important. If you guys are interested in this spot, please let me know, send me an email, and we can get you guys registered for this right away. There's only 4 spots left. It starts in October. I'm just gonna take a sip of water. Whoa, talk too much. Okay, you can see the in-depth overview of what the course has. We go through every single session or every single section that the Alliance puts out there. So really important, okay? Now, here is one more thing that I want to chat with you guys about, and this is our practical crash course. Now, our practical crash course has been around for a while, but it's a new way that we're offering it to students right now, and that is through a video. Now, we were asked by students if we could do a video so that you guys could pause, start, watch it. A lot of times, watch it before your exam. So the practical crash course is a great way to get a ton of material. There's 3 hours of video, and it's taught by Erin Reeds, who is our top practical teacher, which is awesome. You'll get your crash course notes. You're going to get 2 OSCE stations with the answer key, and then you also get access to office hours with Erin Reeds. Now, the next office hours, there's one on Sunday, so coming up really soon, and then there's one on Saturday, okay? And here you can ask all your questions live to Erin Reeds. So super, super useful if you are a student who maybe can't afford to take the full course. The information provided in the crash course is different than the live course or the virtual course as well. So really just that other option to just give you a bit more information, and it's super affordable, which is great too. Okay, so this just kind of shows you what that online classroom looks like for the practical crash course. You have your 2-part video, you have your answer keys, and you have your, your course notes to go through. Okay, so guys, I am all done here. If you have questions, please do contact me. I'm going to stick around for about 10 more minutes and answer any questions that people do have. So yeah, thank you so much. I appreciate you guys spending some time here with me on this Monday morning or evening or afternoon or wherever you are in the world. But yeah, thanks again, and I will wait and see if there's any questions.